Okay, then we have here the microscopic examination of our urine sediments. So microscopic examination of our urine sediments, the last phase, and the entire routine urinalysis procedure. So this is a way of confirming what's really the one causing here the atypical na mga physical exam. Like, cloudy ba siya? Pag cloudy ang physical exam mo, or in terms of the color or red siya, for example, is that the presence of the RBC ba? Or is just related to your medications? It's related to your food intake? So this microscopic identification will confirm if this really related to your pathologic causes or non-pathologic causes. As with the abnormality in the presence of your urine sample, even kahit na clear ang urine sample natin, so again, we could not really say that the urine of the patient is normal unless you have examined that one under the microscope. Okay, so we have here the different stages of our microscopic examination. So prior to actual examination the urine sample under the microscope, you still need to prepare your sediment, your urine sample here for sediment concentration. So the first one, we have here your sediment preparation. So again, the best sample here for doing your microscopic examination should be your first morning urine, because remember that our first morning urine is the concentrated one. So therefore, it will provide us with the accurate estimation of the concentration of different cellular sediments dissolved in the urine of the patient. Kasi pag random, most likely na dilute ang ating urine sample because we tend to urinate every now and then and in a day time, di ba? Pag uminom tayo ng tubig, then kumakain tayo and anything we're having the intake, so we tend to urinate every now and then, so nagiging diluted ang sample natin. And that would not provide us with the correct number or the concentration of your cellular sediments to diagnose someone to have a medical condition. Another one, so you need to return your specimen at room temperature. If, for example, the specimen has been refrigerated, you need to return that one to the room temperature. It should be fresh, so try to check for that. If not, then reject the specimen, because again, we don't want to report bacteria multiplication related to your unpreserved na specimen. Then another one, before you try to centrifuge your specimen, you need to well mix your specimen sample, allowing the sediment which has already settled at the bottom after allowing your sediment urine sample to sit for a longer period of time. So, bumababa kasi mga sediment natin. So, therefore, you need to mix your specimen and allowing the entire sediments to be part of your urine sample for identification. Then we have here the specimen volume. So, the requirement for that is 10 to 15 ml. You should have at least here 12 ml. That's already enough, okay, to perform the entire routine urinalysis, including your microscopic identification. Then after that one, out of your sample, you try to transfer in your centrifuge tube. So 12 ml, transfer that one in your centrifuge tube. Or you could have your test tube lang, pwede din naman. Okay, so then try to centrifuge. We have your requirement 400 RPM for 5 minutes. This is your relative centrifugal force or the G force or GX. Again, that's a unit of your RCF. Okay, then try to cover your tube as you try to centrifuge that one. And then let your centrifuge to stop at its own pace. Okay, do not disturb, do not manually break your centrifugation. Okay, because just wanted na baka para mabilis ang pag-stop, no? Because if you try to manually break that one, ang concentrated na sediment natin, okay, dito dapat, if you try to manually break, madidisturb ito, halo na naman siya ulit. So, mamaya, pag hindi po siya, pag na-disturb na siya, pag mag-decant ka mamaya, baka maubos lahat ng sediment natin. Okay, then we have here the volume of the sediment collected. So, after centrifugation, so ito na siya. You have your supernatant here, and we have your sediment concentrated at the bottom of the tube because of the centrifugation. So the next thing here, you're going to recover approximately 0.5 to 1 ml na lang matitira dito by either you try to perform decantation or by removal of this supernatant with the use of your pipette. Ang recommended ng book natin, you try to remove the supernatant by your pipetting para hindi ma-disturb ito. But by practice, we are doing the decantation. Dinidecant natin. Anyway, pag proper naman, adequate ang ating centrifugation, magko-concentrate naman sila dito. Kahit i-decant mo na i-decant, hindi sila matatanggal dito. May maiiwan pa din siya. So again, ang maiiwan mo dapat dito na sediments, it should be 0.5 to 1 ml. And that's already your concentrated na sediment. The next thing here, you try to transfer out of your 0.5 to 1 ml, kukuha ka ng 20 microliter or 1 drop. You put it on your slide. Okay, and then try to cover with your cover slip. Make sure that you make here a thin na film na hindi nag-overlap ang mga cells natin, and make sure also na hindi siya nag-overflow at wala kang bubble formation. Then after that one, you try to examine already here under the microscope for sediment identification or for the grading of your sediment. Okay, start with the scanner. Okay, so again, what you're going to identify in the scanner would be your squamous epithelial cell. Our squamous epithelial cell is the largest cell here found in our urinary sediments, and that's our basis if you are already in the correct dimension. So pag nakita mo na in clear detail ang ating squamous epithelial cells, mean to say you are in correct dimension. Pag hindi mo siya nakita, baka, di ba, pag kuminsan, pag nag-examine tayo under the microscope, ano ba, iba nakikita mo. Hindi, meaning to say you are not yet on the correct dimension or you are not yet on the sediment itself. So again, try to look for the squamous epithelial if you happen to see that one, so you are already in correct dimension. Start with the scanner, shift to higher magnification in order for you to scrutinize the morphology of your cells in order for you then to identify them correctly. Okay, then we have here the reporting of your urinary sediments. So you can have here your quantitative as an average number, okay, per 10 consecutive 10 fields. So 10 fields, 1, 2, 3, 4, 5, and try to estimate as to the number. We tend to report the quantitative as an average number per 10 consecutive field per HPF in the case of your RBC and your WBC. For the CAS, they are also 10 consecutive field, only that they are being identified under the low power objective because medyo malaki ang CAS natin compared with your RBC and your WBC. On some other cellular sediments, they are being reported as semi-quantitative. Okay, semi-quantitative way of reporting, they are being reported as rare, few, moderate, or many. That's how you're going to report. So in the case, for example, of your bacteria, your CAS, so they are semi-quantitative for HPF. For the squamous epithelial cells, so that's also semi-quantitative, only that is being in the LPF. Again, ang rule natin, LPF versus your HPF, why not OIO? Because again, this is not a stained na smear, this is a wet preparation. So hanggang HPF tayo lang. So ang rule natin, pag malaki ang cell natin, so you try to examine that one under the LPF. Pag maliliit sila, for them to really identify them, so that should be identified under your HPF. Okay, so thank you.